Good.
Hi, how are you today?
Hi, good. How are you?
My name's Taylor and I'm going to be your student nurse today. I'm here to conduct your head-to-toe assessment. It is a physical exam, so I will have to touch you. It shouldn't hurt at all. If at any moment it does, don't be afraid to let me know. Is everything okay with you? Okay, I'm going to close your curtain, wash my hands, and then we'll get started. Okay. Would you like to sit down for me?
Okay.
Okay, I'm observing her appearance, her hygiene, skin color. Skin color is normal. She looks very clean. I'm observing her posture, which is upright, very good. Mobility, which evaluates the cerebellum. Body stature, nourishment. She looks very healthy. Can you tell me your name?
Ashley, just go ahead.
Date of birth?
5/22/86.
Thank you. Can you tell me your name again?
Ashley.
Do you know what day of the week it is?
Saturday.
Where are you?
My house.
What are we here for?
I had to do assessment.
Okay, she is oriented with the ×4. Cranial nerve 8 is intact because she answered all my questions. 12 is intact because she enunciates her response, and 10 is intact because of the use of guttural speech sounds. Cranial nerve 2 is intact because she was able to walk to the chair and sit down without difficulty. Now I'm going to check your vital signs.
Okay.
Going to start off with your blood pressure.
Grab and spin.
Go. Her blood pressure was 118/63, so that's within normal limits, which is 110/139/60/79. Now I'm going to take her temperature. Under your tongue, please. You can hold it if you like. Her temperature is 97.4, so it is within the normal range of 96.4 to 99.1. Now I'm going to take her heart rate using her apical pulse, which is at the 5th intercostal space midclavicular line. Is it okay if I just stick this under your shirt for right now?
Yes, ma'am.
her heart rate was 68, which is in normal limits between 60 and 100. Her respiratory rate was 16, and that's within normal ranges of 12 to 20. So now I'm going to move on to inspect her head. I'm going to inspect the skull for size, symmetry, shape. It needs to be appropriately proportioned and symmetric to her body. I'm going to inspect the hair for color and distribution, even distribution. Her hair is black, no balding spots. The texture was fine, very thick. And now I'm going to palpate your scalp. Do you have any tenderness? No tenderness. Everything is intact. Now I'm inspecting the skin on her face. The skin is the appropriate color. It is warm, dry, soft. Can you smile for me? Since she is smiling, I know that cranial nerve 7 is intact, and she's also blinking at me. I'm going to palpate the maxillary and frontal sinuses for tenderness. Is anything tender?
No.
Tender?
No.
Okay. Now I'm going to assess for TMJ. Can you open your mouth? Move side to side. There's no clicking. Patient can move it side to side just fine. I'm going to palpate the temporal muscles and have the patient clench her teeth. Tender. Okay, can you clench your teeth for me? Okay, she can clench her teeth just fine, so I know cranial nerve 5 is intact. Now I'm going to assess for sensory. So I'm going to ask you to close your eyes, and I want you to tell me if it's a soft, sharp, or dull touch.
Mm-hmm.
Okay.
Soft. Sharp. Soft. Soft.
Okay, thank you. Now I'm going to palpate her lymph nodes of the head and the neck. So the preauricular, and then the parotid, postauricular, occipital, sternomastoid, retropharyngeal, submandibular, sublingual, submental, any tenderness right there, anything? Okay. Now your cervical chains, posterior cervical chain, anterior, deep. Is everything okay? No tenderness or anything? Now I'm going to do the supraclavicular. I'm going to ask you to raise one shoulder and tilt your head to that side. Tenderness? No. Anything? This side? Tenderness? Anything? No. Okay, good. Now I'm going to inspect her neck for symmetry. Can you bend your head back, please? I'm going to palpate her trachea for any masses or anything. It's very symmetrical. And at the midline, there's no pulsation, swelling, masses. I'm going to ask the patient to swallow. Okay. Cranial nerve 9 and 10 are intact. Can you move the head forward, back, side to side, and shrug shoulders? Cranial nerve 11 is intact. Now we're going to do patient's range of motion and strength of muscles. Can you push against my hand? Push against this hand. Good. Now I'm going to palpate and auscultate the carotid arteries. Sun first. Good. Going to use bell. There were no thrills or bruits or anything. Now I'm going to test for jugular vein distension. My pen light. Okay. Okay. No distension notice. Now I'm going to assess her vision. Do you have any vision problems or anything? Use corrective lenses, anything like that? Okay, I'm going to inspect your eyebrows. Your eyebrows are symmetrical. Hair distribution is even. The color under them is appropriate for the rest of your face. Eyelashes are distributed evenly. I'm going to inspect the eyelids. No lesions, ptosis or edema. Now I'm going to look at your conjunctiva. I'm going to have to pull your eyes down a little bit. Good. Good. Conjunctiva is moist and clear. The patient is blinking, so cranial nerve 7 is intact. Her sclera is white and clear. Cornea transparency is shiny and clear. Now I'm going to assess the eye movements with the 6 cardinal fields. So will you follow my pen light, please? Okay, cranial nerves 3, 4, and 6 are intact. There's no nystagmus and there's normal convergence. Now I'm going to test her corneal light reflex. Do not look at my pen light, look at me. Okay? Very good. Light appears symmetrical in both of her eyes. Now I'm going to test for Perla. Just make sure you haven't ink. Good. Pupils are equal, round, reactive to light, and accommodate when I shine the light in them. Now I'm going to inspect the external ear for alignment, position, size, shape, symmetry, and skin color. Her pinnas are equal with the outer canthus of her eyes. Her ears are between 4 and 10 centimeters. Check for discharge. No discharge. I don't see any lesions or anything. The upper part of her ear is firm and flexible. Do you have any tenderness? No. Okay. The earlobe is soft. Do you have any tenderness with either side?
No.
Okay. Do you have any problems smelling?
No.
Okay. Since there's no problems, we know that cranial nerve 1 is intact. Her nose is symmetrical and at the midline. She has no flaring or narrowed nostrils, no discharge coming from them. Her turbinates are dark pink in color. Do you have any problem with tasting?
No.
So can you taste salty and sweet?
Yep.
We know cranial nerve 7 is intact. Sour and bitter?
Yes.
Cranial nerve 9 is intact. Her lips are pink, symmetric, smooth, moist. There's a clear vermilion border. Her buccal mucosa. Say it with your mouth, please. Good. Her buccal mucosa is pale coral pink. There's a slight vascularity. The Stenson ducts are adjacent to the upper second molar. No odor was detected. Her teeth are white, smooth edges, very aligned. There's pink moist gingiva surrounding them. She has no missing teeth. Her hard palate is smooth and immovable with regular transverse rugae. The soft palate is smooth and pink, and her uvula was in the midline. Her oropharynx has no odor. Now I'm going to test cranial nerve 9 and 10.
I have.
Okay. I'm going to test your gag reflex, so I'm going to have to push this in the back of your throat. Is that okay? Thank you. Can you open your mouth and say ah? Good. Cranial nerve 9 and 10 are both intact. Tonsils were not swollen, so I'm not going to grade them. Her tongue is symmetric, smooth, and pink, and moist. Can you stick your tongue out for me? Point it up to your nose, down to your chin, side to side. Cranial nerve 12 is intact. Now I'm going to move on to her upper extremities. The skin first. It is warm, smooth, intact, soft, normal color. I don't see any present lesions. The arms are symmetrical. I don't see any deformities or anything. When I touched, was there any tenderness or anything? No tenderness. I'm going to palpate her brachial pulses. Okay. Now her radial pulses. Okay, there's a regular rate and rhythm to them. Now I'm going to look at her hands. They are smooth, dry, skin is intact. Can you go like this for me? No clubbing of the fingernails. I don't see any spooning or anything. I'm going to test her capillary refill. Okay. Capillary refill under 30 seconds, so it's normal. Her nails are smooth, rounded. There's no grooves. She looks pretty clean. I'm going to assess sensation now. So, dull, soft, sharp. Okay.
Sharp. Dull. Dull. Sharp. Dull.
Okay, thank you. Now we're going to move on to range of motion. It's easier if you stand up.
Okay.
So, I'm going to ask you to raise your arms like this. Test your flexion. This is extension. Can you hyperextend your arms for me? Abduction to the side. Abduction back together. The internal rotation, both arms. External arms. Circumduction, one in full circle. Thank you. Move on to your elbow. Flexion, extension. Can you hyperextend your elbows? Okay, it's okay. Not many people can. We're going to do the forearm, supination and pronation. Okay. Flexion of the wrist, extension, hyperextension, radial flexion, ulnar flexion. Now fingers, flexion, extension, hyperextension. Just bend your fingers back as far as possible. Abduction, adduction, flexion for your thumb, extension for the thumb, and then opposition to each finger. Good. Now we're going to move on to muscle strength. You can sit down if you want to right now. Grip my hands. Very strong grip.
Sorry.
Now I'm going to test your biceps. Okay, go like this. Okay, I'm going to pull against. Good. Okay, now I'm going to try to push them up. You resist me. Good. All right. Now we're going to move on to your heart and your lungs. For this, I will need you to take your shirt off if you're comfortable with that. Thank you. Assessing her skin. Her skin is soft, dry, warm, still the normal color. There's no lesions. The patient is sitting upright. Her shoulders are symmetrical. Her scapular placement and thoracic configuration are symmetrical. Her vertebrae is aligned. Any tenderness?
No.
Now I'm going to assess your precordium for any heaves or anything. No? Okay, we're good. Now I'm going to palpate the point of maximum impulse. It's at the midclavicular line, 5th intercostal space. Apical pulse, so. I can feel yours. Okay. Now I'm going to auscultate. I should hear vesicular sounds over the peripheral lung fills, bronchovesicular over the 1st and 2nd intercostal spaces, and the sternal border posterior at the T4 medial of the scapulae. Bronchial sounds over the manubrium. Okay, you ready?
Mm-hmm.
Okay, now I'm going to move around to the back. Okay, now I'm going to move on to auscultate the heart for rate, rhythm, and intensity. Like I said earlier, your apical pulse was 68. I'm going to start with the aortic area. It should be at the 2nd right intercostal space at the right sternal border. Now I'm going to move to the pulmonic area, 2nd left intercostal space. Erb's point would be the 3rd left intercostal space. Tricuspid is the 4th intercostal space. And mitral area would be 5th intercostal space, midclavicular line. Okay, I did not hear any murmurs or anything to be worried about. Have you had any problems with urination or anything?
No.
No? Do you have any concerns about your urination patterns or
No.
anything like that? Okay, for this part, do you feel comfortable laying on the floor?
Sure.
Thank you. So this time, I'm going to do it in a little different order. I'm first going to inspect stomach and everything. Everything looks normal, skin smooth, dry, temperature's okay. Now I'm going to auscultate. I'm going to start in your right upper quadrant. Move to your left upper quadrant. Left lower quadrant. Right lower quadrant. did not hear any abnormal sounds. They're normal active every 5 to 15 minutes, so that's good. Seconds, not minutes. Now I'm going to auscultate your vascular signs with the bell. I'm going to start at the left and right aortic and go to the renal. And the iliac. And then the femoral. Thank you. Now I'm going to palpate light first and then teeth. Let me know if there's any tenderness or anything.
Okay.
It's good.
None.
Okay, now I'm going to move on to deep. Any tenderness or
None.
anything like that? Okay, that's good. Would you like some backup?
Sure.
Okay, now I'm going to inspect your legs, your ankles, your feet for skin characteristics and everything. Skin is smooth, dry, temperature is the same as the rest of the body. Good. Now I'm going to test your capillary refill on your toes. Capillary refill's good, less than 3 seconds. No clubbing of your toes, no deformities or anything. Now I'm going to check your dorsal pedis and posterior tibialis pulses. There's a regular rate and rhythm in both of them. Now I'm going to ask you to stand in front of me and bend over. Going to check the alignment of your spine. Straight. Did you feel any tenderness while I was palpating or anything? No. Okay, can you hyperextend your spine? Bend side to side. And then rotate. Thank you. Good range of motion for all of that. Now I'm going to do the dull, sharp, and soft. Okay, for the feet too. If you want to sit back down, you can. Close your eyes, please.
Soft. Sharp. Dull.
Okay, thank you. Okay, now I'm going to ask you to stand up. Just take a few steps and walk. I'm testing the cerebellar. She walks with a natural gait. Can you tandem walk heel to toe for me? Thank you. Can you close your eyes and stand on one foot? Then the other. Can you stand with your feet together, arms by your side, eyes closed? There's no extreme swaying or anything. Can you do a shallow knee bend for me? Okay, come sit back down. Okay, try to push your feet up. Okay, push them back. Okay. Now we're gonna do the supination, pronation. Heel shin. Thank you for your patience and your cooperation with everything. I got a lot of information from your head to toe assessment. Your vital signs went in normal limits. Your range of motion for the upper and lower extremities are all good. Is there anything I can do for you, or do you have any questions?
No.
Okay, well, see you later then.
Bye.
Miss Costello.